I never even considered not joining IHPI when I came to the University of Michigan. And it's been an incredible ride.
Being a member of the IHPI community has been extremely helpful. It's wonderful to have so much expertise basically at your fingertips.
In healthcare, we're often each in our own little silo. And through IHPI, we can meet one another, we can talk together, and we can think about how our research has synergies.
Just getting to meet faculty from across the university at various stages in their careers, the ability to tap into that community has been a big advantage for me.
I think I've pretty much used all of the amazing resources that IHPI has, working with all the teams.
We've had a fantastic time working with the policy engagement team. We recently were awarded one of the policy sprints, our team was, and the policy sprint allowed us to partner with the Michigan Department of Health and Human Services. The support that the policy team provided us through that process was invaluable.
That's why I'm here. I want to do research that impacts policy. I want to think about the ways to communicate that, not just in academic papers, but in the format that policymakers are expecting to hear. So I've worked with the policy engagement team and the communications and media team. I have said this before to them, but I have never communicated my work as well as they do. The other part of the people equation for me is the learners. I really enjoy the level of enthusiasm and expertise already that students and other trainees bring. And these are the people who are the future of healthcare.
Without a doubt, the IHPI National Clinician Scholars Program has changed my professional life. It really changed my perspective, not only on how to do things, but on my own identities and what I wanted to do with my professional life, what it meant for a clinician to be able to understand research, to drive research, and to drive research that will affect policy.
IHPI is unique in that they are constantly in tune with and trying to understand what the membership needs and meeting those needs. I did a grant boot camp program that was incredibly helpful. I still think about it. I still rely on the skills I learned during that coaching.
These professional events, these networking opportunities, the research collaboration opportunities are really helpful, and I love that about IHPI.
From the training program to meeting colleagues as a faculty member and creating new opportunities now for learners, it's just the place I want to be when I think across the country.
So welcome, I'm John Ayanian, the Director of the Institute for Healthcare Policy and Innovation, or IHPI as we know it, and it's a great pleasure to have you all here with us today for our 2024 Member Forum. This is an opportunity for us to get together as a community from across the university, and it's wonderful that you're able to be here to connect with colleagues, to connect with our staff, and to help us plan for the next year, sort of how can we support your journeys from innovation to impact. So as we publicized ahead of today's event, this is an outline of the agenda for the next couple hours. We'll start with my presentation of the IHPI Year in Review highlights. And then we're going to have presentations, brief presentations from a number of our staff members talking about the various ways that IHPI already is supporting your research journeys and what else we can do to support you. We'll have a panel discussion reflecting on innovation and impact from 4 of our members, as well as discussions at your tables that will help guide the programs and services that IHPI offers, both those that we continue and new ones that we might develop with your support. We'll conclude with our Policy Impact Award presentations, one of the highlights of this event every year. And then we'll have some time at the end of today's program for more informal networking and connecting with colleagues. So to get started, our year in review. We like to say, and I think this is a slide we showed at last year's event, our members are at the center of everything we do. We have a range of services, programs, initiatives, but it's very much an interactive and collaborative effort between our faculty members, our learners, and our staff. And it's really those connections that make our institute as strong as possible. We continue to have a very productive interdisciplinary membership. We've grown over the past decade from about 300 members when IHPI launched in 2012 to 700 members this year, and that includes both our faculty members as well as our clinician scholars. And we welcomed 54 new members to the Institute in the last fiscal year. Our members come from 15 schools and colleges here in Ann Arbor, as well as our campuses in Dearborn and Flint. IHPI members lead about 10% of the overall research effort here at the University of Michigan, with over $1.6 billion in active research funding. And in the past fiscal year, our members were awarded over 270 new grants. So how are we leading together? We highly value the contributions and strategic guidance of our Institute leadership team. These are members who can serve up to 2 3-year terms, senior faculty within the Institute, as well as the faculty leads of our major areas of focus, such as data and methods, policy engagement, and education and career development. They work with Trish Meyer, our managing director, and me to set the strategic direction, to identify where we should be investing our resources, and how we can continue to build and grow the Institute. We also look to the guidance and the new thinking to help us innovate with our Early Career Faculty Advisory Council. As many of you know, supporting the career development of early career faculty is one of the central areas of focus for the Institute, and we're guided in that effort by our Early Career Faculty Advisory Council. I want to highlight some transitions and ongoing leadership from faculty members in the Institute. Our Data and Methods Hub, the faculty lead was Akbar Walji. Several months ago, Akbar transitioned that role to Tom Valley. We're thankful for Akbar's contributions and very appreciative of Tom taking on that important role within the Institute, working with our Data and Methods Hub team. We've also transitioned from Karen Ferris as the lead of our digital education programs to Adrian Lapidos. Adrian is working hard with our education team to update and refine the open online course that we offer to several hundred University of Michigan students every year on understanding the U.S. healthcare system. So stay tuned for the latest chapter of that. And then I also want to thank Sarah Hawley, who continues to lead our education and career development efforts, and Paula Lance, who's our faculty lead for policy engagement and external relations. IHPI, as many of you know, also supports a number of strategic initiatives, 3 of which are shown here. Our Michigan Program on Value Enhancement, co-led by Jeff Barnes and Leslie Dossett. Our National Poll on Healthy Aging, with the Director Jeff Kullgren and Associate Director Scott Roberts. And then our Telehealth Research and Policy Initiative, led by Lori Buis. So these are important activities that provide opportunities for members to engage in the work of these 3 strategic initiatives. Also want to highlight and thank Rod Hayward for his leadership of our National Clinician Scholars Program over many years. Last August, after an open call for a new director, Tammy Chang was selected as the new director for the National Clinician Scholars Program. We welcome Tammy into this important leadership role and the energy that she brings to it as an alum, in fact, of our Clinical Scholars Program, who's been actively involved as a co-director of the NCSP before becoming the director last August. So the opportunities for new applicants will open up next month for the National Clinician Scholars Program, which is part of a national program that we participate in with 5 other universities around the country: UCLA, UCSF, Duke, Penn, and Yale. That national selection process will be, application process will be open from May to mid-July. And then we also offer our master's program in health and healthcare research that the clinician scholars participate in, as well as a number of our other postdoctoral fellows across the university, particularly those who are supported by T32 grants. So if you know any emerging scholars who would be interested in our master's program, please direct them to Burnett Logan from the IHPI staff team. In the education and career development space, I want to recognize and thank 38 of our members who volunteered to support and lead a number of the programs that we offered in the past year. This slide on the left shows the faculty members who were contributors to multiple programs of education and career development that we offer. And on the right, those who participated in one program. So if you're here and on this list, could you just raise your hand? And we want to share our appreciation for you. So on your tables, you have a two-page document, 2 sides of 1 page, which summarizes the output of our strategic planning process that we completed last spring to guide this third 5-year chapter in IHPI's development. That highlights sort of the process that we went through and some of our guiding principles and priorities that we identified in this process. So 3 of our areas of increased focus that came out of this planning process was sort of building on our success in policy engagement and trying to extend that, promoting the external visibility of our members and their work, and as well as ensuring the sustainability of the Institute going forward by having multiple sources of funding and ways to support the important work we're doing. We also identified 2 areas of continued strength that we really, the sense we got from our strategic planning process and consulting with many of you was really just sort of stay on course and continue to support community and connections among our members and the research productivity of our membership, which is already very strong. So I'm going to present some highlights of the first 2 of these bullets related to policy engagement and external visibility. So one of the new programs we offered for the first time last May, just shortly after we gathered for our member forum last spring, was our Impact Accelerator program. So this was a collaboration of our communications and policy engagement staff teams to develop an intensive 3-day program for members to learn new skills as well as polish existing skills that they have for communicating with policymakers, community leaders, colleagues in the media to really amplify and strengthen and connect the work they're doing. And so this picture shows the cohort of the first 12 faculty members who participated. We collected feedback from that program as we do with all of our efforts engaging with members. And this is a representative quote that we were very pleased to see, and I think really reflected the effort that our staff team put into developing this program, where one of the participants said it was some of the most high yield time they spent in the past year, and they'd highly recommend the program. So I'm pleased to report that we'll be offering it again next month to a new cohort of IHPI members, this time 16 members shown here participating, members both at early as well as mid and more senior stages of their career. Our policy engagement team helps our members to engage and amplify their work in many ways. One of the most visible ways is when our members are invited to testify before Congress, congressional committees, or to give briefings to members of Congress and their staffs. These are just 4 examples in the past year where our members have been called to DC to share their expertise with congressional committees. But there are many other ways that our policy engagement and external relations team can help to support you in getting your work connected to decision makers who can use the findings of your research. Next, I want to just highlight some of what we've been doing to promote external visibility of the Institute and our members over the past year. One important area where we, I think, had substantial impact in the fall was a new Healthy Aging lecture series that we helped to facilitate a number of our members who are experts on aging and aging policy to participate as speakers. And we actually had several thousand community members participate in this virtual aging lecture series. And we view that as a great success of getting the information out that we that have in the Institute to members of the community who can actually use that information to improve their lives. Another new development and a way to promote external visibility in our area of aging focus is a new Michigan poll on healthy aging that we launched as a pilot last November and will be officially launching next month with a new poll on the top 10 health concerns of older adults, both in Michigan as well as nationally. So this poll is really closely tied and related to the national poll on healthy aging that we've led for the past 7 years with sponsorship from AARP and Michigan Medicine. And with support from the Michigan Health Endowment Fund, we're now developing a focus poll, which will be conducted in parallel with the national poll, but focus on older adults here in Michigan and their concerns. So please stay tuned, and as you'll hear about shortly from our staff, this is an opportunity for members to be engaged with the work of the poll teams. In November, we were pleased when we were selected by National Healthcare Leadership Council for their Redefining American Healthcare Award. This was an award to the whole institute, our members and staff, for the work we've been doing over the past decade. And they presented that to us at the fall meeting of our National Advisory Board. There was a tribute to the Institute and recognition of the award by Debbie Dingell, our congressional representative here in southeastern Michigan. So it was great in terms of our external visibility to be recognized by this National Leadership Council. As we've done each year over the past decade, last month we had the IHPI Director's Lecture. I was very pleased to welcome Dr. Eliseo Perez-Estable, the Director of the National Institute on Minority Health and Health Disparities, to speak about the mission of that institute, NIMHD, and to sort of share where the federal government is moving with an increased focus on health equity. And this fits very closely with our own institute strategic initiative on workforce diversity and health equity. So in this next section of my presentation, I'd just like to highlight input that we received from many of you at our last member forum a year ago and how we're responding to that input as we hope to do from your input today going forward. And last year we asked the question, how can we build upon and cultivate IHPI's strong sense of community and collaboration? And through discussions at your tables and as a full group, we came up with a number of recommendations that our staff team and I have been working to implement. One is to encourage more in-person gatherings like the one we're having here today to learn about members' research. And I just want to highlight several of those that we launched in the past year and we anticipate continuing going forward. One was the first gathering of our Aging Research Network. This was done in conjunction with colleagues from AARP who were visiting Ann Arbor to attend our meeting of our National Advisory Board for the National Poll on Healthy Aging. So that is an opportunity that we're looking to sustain with further meetings, both virtual as well as in person and hybrid for that network. We've also convened our telehealth networking event in the past year and look forward to continuing to bring that group together. And then related to our workforce diversity and health equity initiative, we've helped to support colleagues who came forward with a strong interest in convening a new health research network focused on LGBTQ plus health. And that group had their kickoff event very successful in mid-February. And we've done that in collaboration with faculty from a number of departments and schools across the campus. And it's a group that we look forward to continuing to support and collaborate with. And then finally, as a coming attraction, we anticipate hosting a networking event for our Michigan program on value enhancement this fall. That's a program jointly sponsored by IHPI and Michigan Medicine to help bridge the research expertise that we have within IHPI with the operations and quality of care and value of care provided in our health system here at Michigan Medicine. Some other feedback we got was to support pilot funding for multidisciplinary teams and to continue and expand existing funding mechanisms that we had. So I want to highlight 5 examples of that funding opportunities, those funding opportunities briefly, 3 of which are new in the past year and 2 of which are ongoing. The first new one that we launched last year was our Michigan Program on Value Enhancement Faculty Fellows Program. So we selected our first 2 fellows last spring. They've been working over the past year with funding from IHPI and collaboration with the M.P.P team to improve the value of care in our own health system. Another new initiative is our telehealth seed funding program. There we also awarded 2 recipients after an open call for applications, and that program we look forward to continuing. And then a new one, which is currently underway, is a partnership with MIDAS, the Michigan Institute on Data Sciences. And within IHPI, something we've been focused on over the past year is what's IHPI's role in promoting your work related to artificial intelligence as that field really takes off and takes hold. And so we're partnering with MIDAS on one of their data science funding programs and co-sponsoring a track around AI for health policy and healthcare impact and governance. So those applications are coming in the coming month, and look forward to announcing the recipients. And then another existing program that we look forward to continuing is our Sandy Hassmiller Research Funding Awards for early career faculty. This program is sponsored through the generosity of Lou Sandy, one of the members of our National Advisory Board, and his spouse, Sue Hassmiller, who's been a national leader in nursing policy. And we have 2 new recipients in the past year of that program. And then finally, our Policy Sprints program remains very successful. Last year, our Policy Sprints call for applications focused on policy in the cancer continuum. We awarded 2 Sprint awards as part of that last year. And this coming June, we will announce the 3rd cycle of Policy Sprints. The next cycle of Policy Sprints. We're increasing the size of those awards from $10,000 to $15,000 to hopefully promote greater impact. And so if you have good ideas for opportunities to develop evidence and communicate it to influence new policy opportunities, we encourage you to apply. On a lighter note, we heard from you that you were looking for more opportunities to socialize and connect with IHPI members. We were pleased to host another successful IHPI tailgate gathering last September, and the next one is planned for Saturday, September 21st, when the University of Southern California will be in town for a home football game here. So please mark that on your calendar, and we hope to see you and your families there. This is an event that's open to IHPI members and their families. Once again, last September, we hosted a community service day for IHPI faculty and staff in partnership with Ann Arbor Parks and Recreation. And then over the past year, we've had very informal gatherings once a month around coffee and donuts in the morning or popcorn in the afternoon. We've held most of these events up on the 4th floor of Building 16, where the IHPI staff is located, but we'd be happy to take these events on the road to any of our other areas within the Institute if any of your groups want to co-host these gatherings. And then one other recommendation we got was to provide more drop-in space and room for Zoom calls, particularly for faculty members who have their offices elsewhere on campus, but come to IHPI, may want to spend part of a day here, do some hybrid or virtual meetings while they're here. So to meet that request, we've created a new Zoom room up on the 4th floor that's open to all IHPI members. We've also created Zenden up on the 4th floor, a quiet space, which now accompanies our think tank down on the ground floor here in Building 10. And to provide a little enhanced quality of life, we've put in a new massage chair, which as you can see, I had opportunity to test drive just recently and was caught in the act. So you're all welcome, faculty and staff, but we just remind you there's a 20-minute time limit. So the last thing we heard from you was that you'd like better awareness of the work of our IHPI staff and how they can help you. So I'm going to turn things over to Trish Meyer, our Managing Director, who's going to introduce this next part of the presentation.
Hello, everybody. Welcome. It's so great to see you all here today. I'm Trish Meyer. I'm the Managing Director of IHPI. And as John mentioned, based on feedback that we heard from all of you last year, you were asking for more information about how our IHPI staff team can help to collaborate with you and support your work. So today we're going to hear from several members of our teams who will just highlight a few key facts about their different areas. Many of you here today have been members of IHPI for many years. Some of you are relatively new to the Institute, but we hope that over the next 15 minutes you'll either learn something new or remember something important that can help you to engage with our teams. And just a quick note that we will send out a recap email following the forum highlighting these resources. So don't feel like you have to memorize everything or write everything down. You can just sit back and listen. And while I'm sure many of you might be tempted to jump up spontaneously and start applauding when you hear about all the amazing things that IHPI can do for you, please hold your applause until the end, just in the interest of time. And so now I will turn it over to our teams, and I start with Patrick Brady. Take it away.
All right, thank you, Trish. So for those who don't know me, my name is Patrick Brady. I manage IHPI's Data and Methods Hub. And one of the primary objectives of the Data Methods Hub has been to facilitate access to high-value data resources that are broadly applicable to HSR. So a couple of quick announcements in that arena. One is that we've partnered with Precision Health to match 450,000 Michigan medicine patient records to their corresponding Medicare claims. So that's number one. Number two is we also have partnered with a company called Truveta to gain access to their electronic health record data, which covers 100 million patient lives across the US. Truveta is an outside company, and we're excited to be one of the first academic partners in the US to be working with them. I also wanted to point out related to data that, in addition to the number of internal data sets that we manage here in IHPI, there are also external sets of data that our team has a lot of expertise with. This includes things like Healthcare Cost Institute data, Optum Labs, Komodo Health, and also Michigan Medicine EHR data, which we don't manage directly, but we work with it quite extensively. So keep that in mind as you're thinking about which data set to use and who to go talk to for support. We have a lot of expertise that's pretty wide ranging. And then the last thing I'll point out here just really quickly is that overall our team offers a number of services ranging from simple consults around maybe some coding issues or a methods question you might have, all the way up to partnering on things like grant submissions, doing full analytic partnerships, and working with you from a data analysis standpoint. If we can't meet your needs entirely, given the staff that we have, we can also often act as a connector to other groups who might be able to help you as well. So keep that in mind. Feel free to reach out to the IHPI Connect email address for any of us, and we will talk to you after the forum is over. Thank you.
So welcome everyone. My name is Stephanie Jared. I work closely with Jason Wolf on our IHPI and career development opportunities that we offer here at IHPI. So just a few of these programs that we offer include our partnership with the Center for Healthcare Outcomes and Policy to offer members submitting their K or first R01 a mock study review. So if you're interested in holding one of those, please feel free to reach out to myself or Jason. We can get that scheduled for you. In addition to providing grant and career development programs to support early career faculty, we're trying to expand these programs to offer mid-career level faculty support as well. So we welcome feedback on such programs that we can offer you. And we offer a number of student programs, including a 6-week online course about the U.S. healthcare system offered in the fall, and our summer student lunch and learn and skill building seminar series. So if you have students working with you over the summer, we welcome you to send us their information. We will invite them to our summer student programs. So thank you. Lauren?
Hi, I'm Lauren Hutchins. I'm here representing IHPI's Grant Development Services team. So we provide in-depth proposal review and other resources to help you put your best foot forward when you're applying for research funding. So just a couple things that I wanted to highlight. We maintain a repository of funded health services research proposals that have been graciously contributed by other fellow IHPI members. So what you may not know is that we're always looking for new contributions to that repository. So if you have any that you might consider contributing to the benefit of your colleagues, please consider that. Secondly, we also maintain boilerplate language on our website that describes IHPI's services, infrastructure, and other resources. So consider using that in your proposals to strengthen those in your facilities and other resources or environment sections. And lastly, we run a writing effective biosketches workshop, and biosketches are something that we'd be glad to review for you. That might be something to consider in between busy grant cycles when you have some time to be thinking about that piece. So turn it over to Diane.
Thank you, Lauren. Good afternoon. My name is Diane Singer, and I'm the project manager for the National Poll on Healthy Aging, which began as one of IHPI's signature initiatives since its launch in 2017. And we make our National Poll on Healthy data available for free public use through ICPSR. And we currently have 9 waves of data available, and we plan to newly release data in June and do that on an ongoing basis. In addition, we have NPH data that has not yet been released to the public or been used in academic publications so that can be shared with IHPI members as well. And then the NPHA sample size is growing. As you heard, this fall we began fielding questions to an oversample of adults in Michigan. So we now have Michigan-specific data that also we explore through the national poll on the same topics. And so we also oversample on race ethnicity. And this year, in fact, we expanded our the reach to the age limits that we're going to. We used to be at 80, but now we're expanding that. And we first had our last poll, we had a respondent who was 101 years old. So, and the total sample size from our latest poll fielding was over 4,000 respondents. So all in all, we have a lot of data on adults 50 and older. So if you have questions about the NPHA data or have an interest in collaborating with us on future polls, please reach out to us. Thank you.
Hi, I'm Emma Steppi. I'm a project manager here at IHPI. I'm here to talk to you about some of our research networks. So as John mentioned, we have several research networks associated with our strategic initiatives. Those are around aging, telehealth, health equity, LGBTQ plus health, and healthcare value. So networking activities have included actually in-person networking activities, as well as seed funding opportunities, sharing of resources, research, and other opportunities through our email listservs, as well as presentations for and by members. If you are interested in joining any of these research networks, please reach out to either me or we have the IHPI Connect UMich email address now. And I did just want to highlight a few upcoming opportunities to get involved with 2 of the research networks. In May and June, we're going to have 2 hybrid presentations by the Telehealth Research Network. One on publishing telehealth and digital health research and how to position your work for the biggest impact. And then another with an update on virtual care at Michigan Medicine, current and future directions. And then lastly, for the LGBTQ plus health research network, which has recently launched, we are planning to compile recent publications. We know that there are folks all across the university, across the institute, working in this space, and we would like to share a body of work with members of the network and kind of elevate that work. So thank you.
Hello, everyone. I'm Megan Petiprin with the IHPI Communications team. Our team aims to provide communications resources and strategic advice on messaging to help you disseminate research findings to various audiences who are seeking evidence on timely health and healthcare issues. One easy-to-use resource that we offer is an online communications toolkit, which includes tips for effectively sharing your research findings with broad audiences and guidelines for preparing for media interviews, creating visual abstracts, using social media to promote your work, and much more. Another way we aim to showcase your expertise and research is through your IHPI member profile. So please make sure that is up to date. This is an easy way for journalists, policy stakeholders, fellow researchers, and others to get to know and connect with you. We will email a form in the coming days to request edits to your profile, so we ask that you look out for that. And finally, we can better support you if we know more about your current work. Let us know about your recent or upcoming policy relevant or newsworthy research. We have a research update form that will be emailed, or you can reach us anytime at ihpiconnect@umich.edu. And we can also connect you with your unit, department, or school communicator to amplify your work. We're looking forward to working with you, and thank you.
And to build on that, I'm Kara Gavin, also from the IHPI communication team, and just wanted to amplify what Megan just said. We really do want to hear from you about papers that you've had accepted that are coming up that you feel need a broader audience, deserve a broader audience, or when you have expertise that pertains to something that's in the news, even something that seems as trivial as a disease that a celebrity has been diagnosed with, but you know about that, or the delivery of care for that patient population. We would like to know that in a timely way so we can maybe connect you with journalists who are looking for an expert right now. So please do get in touch. We also offer training for social media and opinion writing, and you'll see some opportunities coming up on the IHPI calendar soon that you can attend for that. And then we also run, Megan and I, the IHPI Twitter account and LinkedIn page. Even if you're not using social media yourself as a professional, we are looking for ideas for things we can share through those channels and also share with the channels across the university to reach broader audiences. So tag us or just send us ideas, and we really do want to hear from you. So thanks very much.
All right, last but hopefully not least. Hello everybody, my name is Trevor Lietzo. I'm part of the Policy Engagement and External Relations team, along with my colleagues Eileen Kostanecki and Sarah Wang, who are here today as well. In addition to the Impact Accelerator training and policy sprint programs that you heard about earlier, the Policy Engagement and External Relations team also hosts one-on-one office hours where we can meet with you to discuss your work and strategies for framing it and sharing it with the right policy audiences. We're also available to help prepare you to meet with policymakers, deliver testimony, participate in congressional briefings, or other policy-related event. And lastly, we also have a toolkit and other online resources you can access, such as how to create policy briefs and one-pagers, best practices for policy meetings, how to submit comments on federal regulations, as well as others. So thank you, and we look forward to connecting with you.
So let's hear it for our amazing IHPI staff. All of our staff team are here today sitting at the tables, and as Patrick mentioned, we will all be available at the end of the event during the networking time to speak with you further. I also want to give a couple of shout outs to Stacy Trussell. Where is Stacy? Stacy, who is our events planner, who is responsible for everything in this room today. Thank you, Stacy. And also Emily Smith, who is our multimedia designer, who is responsible for our beautiful slides and all of the materials that are on your table. So thank you to both of you. And speaking of the materials on your table, on the table tent, there is a QR code that will take you to our website where you can find more information about everything that you've heard today. Again, these were just a few examples. We have many more resources, so if you want to go in depth, obviously you can scan that QR code or just go to our website anytime. And finally, as we have mentioned previously, we have a new email address, IHPI Connect, which basically just send any question you have, go to that email address, and we will then connect you with the appropriate person or team who can help you. And so now we are going to open it up for questions, both regarding John's presentation as well as anything you heard from our staff team. So I think John is going to come up front, and we welcome your questions. Thanks.
Please, so the floor is open for questions, comments.
And we have mic runners who will bring you a mic.
Yes, Mike. And Jessica's on her way.
Thank you so much. Mike McKee with the Department of Family Medicine. So my question is, how are these major topics selected? So for example, we have healthcare value, LGBTQT, plus. So how are these topics selected, and are there opportunities for other topics to be selected?
Yeah, so the topics that we featured today, and there are some others on our website, such as Medicaid expansion or opioid policy, those are ones typically that were developed through a combination of ways. Feedback from members, and we have certain criteria that we use for choosing signature or strategic initiatives for IHPI. And one of the key ones is that we have one or several IHPI members who are passionate about the topic and see an opportunity to do something through the Institute that's can have impact beyond maybe the work of an individual or a small team. We also seek the guidance of our leadership team, our faculty advisory council, and our national advisory board. And then we put all that together and try to think, what really defines strategic or signature initiatives are areas where we feel the university already has existing strength, but through the work of the Institute, partnerships between faculty and staff, and sometimes external stakeholders, for example, ARP for our National Poll on Healthy Aging, where we have an opportunity to do something important that just wouldn't be there. We're not looking to duplicate efforts that would otherwise happen on campus, but really look for opportunities. So, I would say, one of the themes of today's forum is, bring us your ideas, and we will figure out how to work with them. And, sometimes that may be just, supporting the work of a specific team to have more impact. But other times when we see it as a bigger issue, and particularly an issue where interdisciplinary work could make a difference. So, bringing people together from multiple schools and departments to work on a challenge in a new way. Those are the types of opportunities that I think are best suited for these signature initiatives. Other questions? How many of you use Medicare or Medicaid data in some part of your work? A sizable number. Well, I might turn to Patrick for an update. Many of you may be familiar with sort of all the new policies that have been proposed by CMS for accessing Medicare and Medicaid data. And Patrick and Catherine Ashbaugh and our policy engagement team led by Ayanian Kostanecki have been working hard to develop our response from the University of Michigan to those proposed policies. And Patrick, I might turn to you for an update on that.
Yeah, that sounds, whoa, that's a little loud, isn't it? This is a topic that's caused some rapid aging on our team. So if I look a little different, that's why. So there are two topics related to CMS that I wanted to cover. One is related to the cyber attack that happened in August, which put all of the DUA changes on pause. That has been resolved. So we spent about 7, almost 8 months proving to CMS that the data was not impacted by the cyber attack. So it was not touched during the cyber attack. So that's good news. So that issue is now out of the way and we can move on from that. The second policy that came from CMS recently is that they are aiming to move data that we currently have on site, and this not just for U of M, it's for every institution across the country that uses CMS data, move that into what's called the VRDC, which is their virtual enclave system. Now, the downside of this is that it's quite expensive to use that system. And so we have been crafting responses to CMS on behalf of our members and our researchers to, perhaps provide other ideas for CMS to think about how they could handle this more smoothly. The timelines they presented for doing this are quite aggressive, and we expect to see probably delays in their timeline. We just had an announcement about a delay, I think it was last week that came out. So we've crafted a letter on behalf of IHPI to send to CMS. We're also going to continue to encourage all of you to voice your own opinions as well to CMS. We can share some talking points with you about what we've said in our own letter, and we will continue to monitor the situation as things change. It's a little difficult right now because we don't have a final policy from CMS on a final timeline. So we have to assume that what they've said right now is the word of the law, and we should follow that until we're told otherwise. So that's kind of the way we're playing this right now, just assuming that things will change. We just don't know what the exact timeline looks like. And we're thinking about different ways to help support all of you who are doing Medicare research as best we can, given the changing environment.
And what we learned with this most recent announcement is the change in policy, which was set to take effect August, just 4 months from now, has been delayed into 2025. We still don't know for sure what those changes will be, and Patrick and his team and Ayanian are going to be following that very closely, and we'll keep you all informed particularly those of you who are ongoing users of Medicare or Medicaid data from CMS. Yep. Great. Other questions? Chad. Oh, Jeremy's coming with a mic.
For Patrick, yeah, just for Patrick to follow up on that, on the CMS thing. So do you think that? Oh, there we go. Too loud. All right, perfect. Just to follow up with Patrick on the CMS issue. So I know that there's been a delay in it, and I'm just wondering what your thoughts are. Does that mean that their CMS is most likely sort of figuring out exactly, the final shape and form of it, or do you think that all researchers on VRDC is inevitable? It's just a matter of like the cost structure and then like other details related to it?
So I think it is the second part of that. I think it is inevitable. I mean, I think the entire industry is moving toward the enclave model. We kind of expected delays to happen because like I mentioned, the timeline was very aggressive that they proposed. So you think about the fact that it takes almost 9 months to get a DUA through. You can imagine having everybody across the country rushing to change their DUAs to move their VRDC. That doesn't seem feasible. So I think CMS is trying to figure out the logistics of how to make that happen. But also we made suggestions about, looking at the pricing model of VRDC. There are different mechanisms that we see that they could reduce the costs of the VRDC. Whether or not CMS takes those suggestions into account, we don't know yet. We hope they will. But we're trying to think about different ways to, assuming that this is going to happen, think about ways that we can make it the least negatively impactful process that we can through influencing CMS's decisions.
Chad.
So Patrick, just to follow up to that, if you think the enclave model is inevitable, how are you thinking about changes to the data methods hub in terms of it's not going to be just for Medicare, it's going to be for a lot of the external data. So how are you thinking at all about changes to your group and how you might serve faculty in a different way?
Yeah, that's a good question, Chad. So, there's a couple of ways that we're thinking about this. One potential option is that we have sort of like an IHPI DUA. So it's sort of like a broad DUA where we have analysts occupying seats, supporting different projects. That's a way to sort of spread the cost out more. So it's not, everyone paying the same thing over and over again. So that would have some financial benefit in terms of reducing costs. That's one potential option. We're also looking at other options for on-site data, one of which is the LDS or limited data set. Now, as the name implies, there are limitations to that data, but it still could be useful for, especially people getting started with their first, let's say a K award or their first real project. We're doing some evaluations to see if that would be a useful investment from IHPI's standpoint to buy that data and have it on site here at IHPI. So, there are structural things we need to think about in terms of how do we kind of move into this new environment and this new world of data access where it's like the Disney Plus model. Now we've got a bunch of different subscriptions to different data providers, and thinking about how our team can continue to support people. That's going to be sort of an ongoing discussion and, working with the policy changes that come out and the information we receive from CMS and other groups, but we've been thinking about that quite a bit.
Time for one more question, if anyone has one. Okay, well, please join me in thanking our staff team for their great presentations.
To switch to the more interactive part of the day's activities. So as you know, our theme for this year for the forum is Innovation to Impact, how IHPI can support your research journey. And as John indicated in his presentation, this information that you generate is very valuable to us, and we do take it into consideration, and it helps to inform our work. So we really appreciate your participation in this exercise. But as we're thinking about innovation and impact, those are very broad terms and they mean different things to different people depending on your work. And so in order for us to successfully be able to support you in these arenas, we really need to dig a bit deeper to find out what this means to you in your line of work. So for the next 15 minutes or so, we're going to do an exercise at the table, thinking about these questions in the context of your work. How do you define innovation and how do you define impact? And basically, we're going to take about 3 minutes where you will just, on your own, brainstorm as many ideas as you have for each of those questions. So just don't edit yourself, just whatever comes to mind, write it down. Then when I give the signal, we're going to do a pair share activity. So you'll turn to someone at your table, kind of share what you wrote down, discuss it, and then share it out with the whole table to write down those ideas. So someone will need to be the scribe and write them on the pad. Then we're going to quickly transition to a panel discussion where some of your colleagues will share their reflections. And then we'll come back to a broader group discussion about how IHPI can support innovation and impact within your work. So that was a lot of instruction, so I'll break it down. So for the next 3 minutes now, just start thinking about these two questions, writing down any ideas you have about how you define these concepts in your work, and then when I give the signal, we'll switch to the next phase. So go.
So thank you, everyone, for the lively discussions you've been having at your tables. We look forward to hearing more about the insights you've been sharing with each other. For this next part of our program, I'd like to introduce 4 of our colleagues to the stage who are going to share some of their personal reflections on innovation and impact and the work that they've done within IHPI and beyond, and the context of their research journeys. And we hope that this will be a way to spark some new ways of thinking for all of us about these concepts of innovation and impact in our work. So please join me in welcoming Drs. Tony Coe, Tom Valley, Sarah Reeves, and Steve Brolio. So welcome and thank you to all 4 of you. I think we're going to be starting with Tony sharing her reflections, and then we'll move down the table, finish up with Steve after hearing from Tom and Sarah. So Tony, thank you.
Thanks, John. Hi, everyone. My name's Tony Coe. I'm an assistant professor in the College of Pharmacy in the Department of Clinical Pharmacy. And so my work really focuses on how healthcare delivery and health policy impact medication use, particularly in older adults and older adults with cognitive impairment or dementia. So when I think about innovation and impact and IHPI's role as well, I thought of this one example with regards to being able to partner with the National Pool on Healthy Aging. A lot of the work that I examine is Medicare Part D medication therapy management, and overall has low receipt, low awareness, and strategies are needed to increase the use. So most of other studies have looked at one healthcare system or community pharmacies providing the service, but we didn't have a good national representation of older adults and their awareness of medication reviews or comprehensive medication reviews through Medicare Part D. So we were able to develop a module, administer that to the recipients of the National Pool on Healthy Aging, and analyze the results. And through the great communications team here, we had news releases that were picked up by several media outlets, as well as the report that was published. And I had the opportunity to discuss this problem and the findings on NPR radio. So when I think about that as an early career faculty member, that's something that's very impactful for me to be able to put on my CV or packet, but also thinking about being able to publish within scientific journals. So I had 2 articles that came out of that poll. And I think that going forward, being able to partner with the new expansion with the Michigan piece is really exciting. So that's one example of impact.
Hi, everyone. I'm Tom Valley. I'm an associate professor in the Division of Pulmonary and Critical Care.
And my research focuses broadly on trying to understand and improve the way we deliver ICU care, particularly within rural and minoritized communities. And, I think when I think about innovation, we talked about it at our table, but innovation can be a tough thing, I think, to define, particularly in health services research. When I'm on a study section and you have kind of the innovation section, I think it's difficult in our line of research, personally, I think, because very rarely do you have situations where someone is thinking of something entirely brand new that's never been done before, like some new molecule or something like that, right? Oftentimes, I feel like in our work, it's we're taking things that might have been used in other ways and looking at them in a different lens. In my journey, in my career path, I think IHPI has been very useful and very helpful for me in several ways along those lines. I think one is just the workshops and sessions that are provided to early career faculty, and even when I was a fellow, I remember Chuck Huber coming from Stata and being able to learn from, a clear expert, and just the many different workshops that are provided on different methodologies and different ways to do things. I think another kind of tangible way that IHPI was helpful from an innovations perspective was, very early in my career as a fellow, I was working with my primary mentor, Colin Cook. And Colin had this idea to look at, to use an instrumental variable analysis to look at ICU use and outcomes. But neither of us had ever done it before. Colin had pitched in his case, but we've never actually done it before. And so, back then everybody came in every day to IHPI and Building 16. And so Colin was like, hey, why don't we just, Andy Ryan's like right down the hall over here. Why don't we just walk over there and just like ask him how to do this? So we got up during my mentor meeting with him, walked across the hall, knocked on his door, and we just sat down and talked about how to do an IV analysis. And Andy ended up being a very great collaborator for me, ended up being an advisor on my Career Development Award. And it was all just a matter of being able to just walk down the hall and ask him these questions. And I think that's part of the power of having so many brilliant people co-located in this fairly tiny space, being able to do those types of things. I think when I think of impact, I had an attending when I was a resident who'd often say, if we're not doing something to help somebody live longer or feel better, then what are we doing? And I think IHPI and the people working within IHPI do amazing things from that perspective in terms of helping people live longer and feel better. And I think from my personal journey, IHPI has been very helpful in allowing me to do work that I feel can be impactful, whether it's creating K-writing workshops so that we can improve our Career Development Awards to, when our group published work related to pulse oximetry, the IHPI Communications and Media Relations team were some of the first people we contacted because we recognized that, to really broaden our impact, we needed to be able to reach a diverse audience. And they were incredibly helpful in terms of crafting our messaging, helping get our message out there, and then as it evolved, helping from a health policy lens in terms of communication and speaking with the people we needed to speak to try to affect change. So I think there are a number of really amazing resources available to us as IHPI members.
Hi, is this on? Can you guys hear me okay? I'm Sarah Reeves. I'm an assistant professor in the Cheer Center in the Department of Pediatrics and also in the Department of Epidemiology. And my research is focused on sickle cell disease. And just so we're all on the same page, sickle cell disease is a rare chronic condition, and it's associated with significant morbidity and early mortality. And in the United States, 90% of the people that have sickle cell disease are Black or Hispanic. And it's not news to this group that means that folks with sickle cell disease generally face racism and discrimination both inside and outside of the healthcare system, which further complicates the management of an already complex condition. My research is focused on leveraging data to find opportunities to improve the lives and outcomes of folks living with sickle cell disease. My work's multidisciplinary in nature, and I think about it in two different ways. I think about it in terms of multidisciplinary collaborations, and then multidisciplinary data sets, which I can kind of explain. But I work a lot with the Michigan Department of Health and Human Services, or MDHHS, and even within MDHHS, work with newborn screening, public health genomics, Medicaid, children's special health care services. And then we work with clinicians of many different types and parents and families and people living with sickle cell disease and community-based organizations. And then in terms of data systems, one of my primary projects is linking and deduplicating 12 different sources of data to identify everyone with sickle cell disease in the state of Michigan and follow them over time. And I do that project with MDHHS. So I'm telling you all this to set the context of innovation, which is I think about innovation and how can we spread further in those two circles? How can we take our collaborators and innovate? Who have we not thought of that should be part of the conversation? What's an innovative way to bring in a different perspective? A dentist, someone that has run a very successful community-based organization for another condition and leverage that. How can we think about really innovating within our collaborators? And then data, right? We all love data, we're here. And so how can what are other places? What does ISR have that we could incorporate in that we've never thought about that could help us think about how the built environment can help people with sickle cell disease thrive? Just really how can we collaborate with people and data sets to expand the impact of our work? Which this is where IHPI shines, right? The people. I'm going over to talk to Andy Ryan, seeing what Kate's doing on the newborn screening nationally, how Renu's thinking about Medicaid unwinding, right? Like all these things we can incorporate in our own work and think about, and that's, I think, really where we can excel in IHPI. And then in terms of impact, I think about impact. Did we do something that brings us further together than it was if we were doing it on our own? So, for example, maybe 2 years ago, I guess I'm not sure, did one of the IHPI policy sprints. And what we did was recently the Michigan Department of Health and Human Services expanded children's special health care services benefits for people with sickle cell disease through the lifespan, so including adults also. But it was a little bit hard to implement because we couldn't find adults with sickle cell disease unless they were in one of these siloed data sets in the state. But as I was talking about earlier, I have this project that's funded by the CDC where we combine 12 different sources of data to find everyone living with sickle cell disease. So in the policy sprint, we worked with Michigan Department of Health and Human Services to say, here's folks that you might be missing if you're looking at Medicaid only or at clinics only, and really trying to target the most vulnerable populations to enroll in the Children's Special Health Care Services expansion. And another thing I wanted to say as I was thinking about this is that, I've been doing this for a while now, but I hopefully still have a long career to go, I hope. And this has really changed for me over the last decade, how I think about innovation and impact. And so how I'm answering this at this point in time will probably be a lot different than I am in the future. And I also think that's okay as long as we just keep reflecting back on our work and what that means to us and how we can incorporate that with our priorities at the time. Thanks.
You guys are so quiet. So first of all, I just want to thank IHPI for the opportunity to speak today. So my name's Steve Broglio. I'm a professor in the School of Kinesiology and director of the Michigan Concussion Center. I think I took a different slant than my colleagues here at the table. I am a reluctant policymaker. This is not something that I actively sought out when I started my career. And in fact, I probably hid from it for a long time. Probably like most people in the room, I started as an early career faculty member. I had my lab. I had my 1 or 2 students, undergrad and grad. And we were doing a lot of work at local high schools. Oh, I should mention that I do all concussion work. Sorry, I should have started with that. And so we were working with local high schools on research projects, which would lead to, hey, can you help us have our own internal policy. And I would just sort of kind of give best guidance at the time. That then sort of translated into some opportunities that my friends were sort of, I don't have time to do this, can you do it for me type of thing. So helping US Soccer, US Cycling, write some of their policies. So obviously now reaching out into larger audiences. It wasn't until about 2014, we received a grant that was a pretty large grant that was funded by the Department of Defense and the NCAA. And that's when I connected with Christina Coe, who is in the office, was in the Office of Research. She has since left the university. And then Ayleen Kostanecki. They drugged me kicking and screaming over to DC to sit in front of a couple congressional reps and give briefings. I fumbled my way through it. I'm not going to say I swore I would never do it again, but I definitely was uncomfortable. I'm just being quite honest with you. But because of that initial experience, I then started getting put into rooms where policies were being discussed and written. And I cannot tell you the number of times I would be in a room looking around, thinking to myself, I'm the youngest person in the room right now. I'm going to keep my mouth shut and just listen. But that experience and exposure to those things, you start to learn kind of what becomes important to the organization, how does the science inform the policies that are being written, being discussed. And it wasn't until about 2022 when I think Ayleen suggested I complete the CHART Fellowship, which I did, and started understanding really kind of the nuts and bolts of policy development. And then in 23, I was in part of the inaugural class of the IHPI Accelerator Program, which I think the next class is coming up starting next month, which is great. So if anybody's in the room thinking about this, you got to take the class. I think because of that and just kind of with time and getting comfortable with my craft, now I'm probably a little bit more proactive in seeking out opportunities to help work with state providers, work with national providers, international groups to help inform policy, in part because it took me a long time, but that's really the way we as scientists, we as clinicians can have the biggest impact. I can go, I'm an athletic trainer, that's my training. I can go to a high school and I can help those 60 kids on a football team, and that's great and it's super rewarding. But writing a policy that affects 1,200 member institutions of the NCAA, that's amazing. So I think what I would say is as I look back on my career, which I'm at the halfway point, I did some retirement estimates last week, and I'm being generous. I think what I would say is it's never too late to start. I think, I don't want to speak for everybody in this room, but we're all sort of like, I don't want to make a fool of myself, and that's okay. Like, just take time and learn your craft and kind of learn how your science fits into kind of what's being discussed. And develop your research agenda and kind of think about how you can influence the things that are being talked about. And it takes time to become comfortable talking about the work that you're doing. To this day, I try to deflect as much as possible about the stuff I do. I'm more than happy to talk about the things that our trainees and staff and faculty within the Concussion Center do. But when it comes to my own work, I'd rather not, to be quite honest with you. But it takes time to kind of build up that confidence and push your work forward. And I think as that happens, you will realize it is super rewarding to be able to talk to policymakers and try to nudge that needle one little bit at a time. And I think I'm going to end with kind of the discussion we had at our table right before the panel started, that changing policy is not a 0 to 100 process. You're not going to go from where we are today to where we should be in 20 years today. It is very incremental. And somebody said, I can remember who said it at the table, but they said, it's taking a bite of the apple one bite at a time, or it's eating the apple one bite at a time, because eating the apple all at once is really uncomfortable if you try it. So, so just be patient, and just because you don't get everything you want today doesn't mean you won't in the future. Thank you.
So thanks to all four of our panelists for sharing your insights. We're going to open it up for questions from all of you or reactions from your own experiences. Before we do that, I just want to see if any of our panelists have questions for each other, or do you want to add to anything you heard from any colleagues on the panel? All right, so we'll turn to all of you. What thoughts do you have, building on what you heard from our colleagues on the panel or from your discussions at the table?
Hi, how's it going? I'm Rahul Ladhani. I'm the School of Public Health. This was a very, very fascinating panel. Thank you so much for that. I actually made a note of what Tom mentioned, right? I mean, it's going to be, I'm going to put this on my, I don't know, office desk or something. If you're not doing something to make someone feel better or live longer, what are we doing? But I think one point that Sarah mentioned about, bringing together best practices from a variety of sort of sources, right? That really spoke to us at this table as well. We talked about, especially given the diversity of methods and disciplines within healthcare. Like, I mean, I talk about from, let's say, things that econometricians have been doing 20 years ago in causality. Computer scientists began 10 years ago, and that was supposed to be novel, right? I mean, not to undermine either of those disciplines, right? But I think having structured ways to bring about, this disciplinary collaboration and in terms of best practices from field A, field B, field C, that's something that is definitely a big innovation, especially for the kind of work that we do. So thank you for that.
Great, thank you, Rahul.
And I think to that point, like if you just look at the geography within this building, right? Like Sarah and I are on the same floor, on the ground floor in Building 16, and just in our hall, how many different disciplines and experts there are, it's just amazing. And I think it just leads to a lot of opportunities, right? It's just like natural opportunities to just bounce ideas off people, and maybe you don't have a direct collaboration, but you're just elevating each other's work, just being around each other.
And I think I might add, since the very launch of IHPI back in 2012, we've talked about the Institute as both a physical and a virtual institute. Obviously, that was all shuffled by the pandemic when we all became virtual for a period of time. But, these opportunities for collaboration, certainly they're helped by being in proximity and being able to walk down the hall. But, for our members who don't have your offices here at IHPI, we want to engage with you as well, whether that's providing space for you to come to work at IHPI when you choose to. We have, as we mentioned during the opening presentation, new drop-in spaces that we can help you use, but also making virtual connections. And now that we're also comfortable, working with tools like Zoom, I think, we can form some of these interdisciplinary connections, both in person, say down the hall or next door, as well as virtually. And that's something that we as an IHPI team are looking to help foster. Yes.
Hi, Dan Hertz, College of Pharmacy. I wanted to follow up with something that Steve said about biting the apple and how you said it's fun to go and improve things for 60 kids at a time, but really passing one policy and changing it for 12,000 organizations is real impact. And that's not biting the apple, that's like swallowing the whole orchard, right? So I'm sort of in a similar space where we're trying to go clinician by clinician and change the way they're using some tool. And really what we want to do is get a national policy passed. So can you talk a little bit about the different perspective and the scope and the scale and what IHPI did or can do to help you change the level that you're working on to really do something nationally?
Yeah, thanks. So I think I'll clarify the comment about the apple orchard. So I think what I was trying to say is, I'll use my world, in the month of August, preseason football practice, it accounts for 50% of all the concussions that occur during the regular season. of the entire football season. So you have 1 month, 4 weeks, that contributes to 50% of the injuries that occur over a 16-week period, right? So there's something going on in that month that needs to be addressed. And there's a lot of contact that happens. And so we had the data, we went into the NCAA meeting, and we were prepared to basically say, you need to eliminate virtually all of your contact practice in the month of August, right? That's eating the entire orchard. What we settled with is we will eliminate 2-day practices, and then after every contact practice, there has to be a non-contact day, right? So we took a bite and we were headed in the right direction. That's what I meant to say by that. How IHPI and other groups have helped me think about this is when you write policy, I think my instinct, I don't want to speak for everybody, my instinct is like, I'm going to make the guardrail so tight that this thing will never happen ever. But that's just not practical. And so it's teaching you or making you think about widening the guardrails wide enough that in particular, the clinicians have space to do their job and the freedom to do their job that they know best, but not so wide that like it just flies off the rails. So I think those are the things that, and that's kind of a push and pull, right? I think in moments of crisis, we want to bring things in, and then when things are great, we want to widen things back out. But trying to think about every circumstance that you can think of and like, how do we modulate where those guardrails are?
So I actually have a question for all of you on the panel, which is, we often talk about sort of the balance of quantitative and qualitative data to influence policy. And do you have any examples where you've used both? I think it was Lisa Simpson who said, your data make you credible, but your stories make you influential. Have you seen that in any of your own work? Because we tend to be very data focused. We've got great mixed colleagues who teach us about mixed methods and qualitative methods, but oftentimes the bulk of research articles, for example, we're publishing are quantitative. But when you go to talk to policymakers or community leaders, how do you address those different perspectives?
I guess I can start. So besides some of my work with Medicare data, I also partner with a community organization, and as part of their program, it's a AAA, the Area Agency on Aging within Michigan, and they have a Transitions of Care program as well that incorporates community health workers and pharmacist telehealth services. So we partnered with them to do a mixed methods evaluation, and part of that was looking at facilitators and barriers to implementation and expansion of this program. And it was the stories that came out of the interviews that convinced some of the administrative and director staff level for expanding into different disease states as well.
Yeah, thanks, Tony. That's a good example. Any other thoughts or reactions?
After decades of neglect for policies around sickle cell disease, there's a lot that's going on now at the state level and the federal level. And given my role as knowing about the epidemiology of sickle cell disease in the state of Michigan, I've been asked to talk to both state and federal legislators about the policy expansions or signing on to support bills or different things. And I do not have sickle cell disease and do not have lived experience. And so I tend to partner with someone that's living with sickle cell disease or a parent, and they'll give their story of how sickle cell disease has impacted them. And then I, much less impressively, talk a little bit about the data and knowing how we can support each other and pull those two worlds together. It's not, I'm not saying that this is qualitative research, what I'm doing there, but bringing someone living with sickle cell or their parent has been a really impactful way, and honestly very meaningful for me and our research team too, to understand the why of what we're doing.
Steve.
Sure. I can speak. I think I have several examples in terms of my own research where being able to combine quantitative and qualitative data has really kind of increased the impact of my work. But I'll actually speak to something that caught our attention as researchers. I mentioned before our pulse oximetry work. We had recognized a clinical problem but hadn't really understood the scale of it. there had been small quantitative studies conducted previously that had demonstrated potential issues with pulse oximetry, but most of the conclusions of those studies had essentially said there's very little clinical impact here. But it wasn't until we, as a group, had read a firsthand story written by a medical anthropologist from MIT who talked about her lived experience as a white woman who contracted COVID, married to a black man who contracted COVID, and their use of a pulse oximeter and the different numbers that it was providing between the two of them, that something clicked for us as researchers that said, hey, like, there's something here, and we have the ability as researchers with access to large data sets with granularity that we can investigate this like no one else has before. And so I think not only does it help improve the impact of our work, but it also, I mean, those stories are really meaningful. They draw your attention and can help motivate additional work on our end as well.
Thanks. I think Steve.
Yeah, I think a similar story to Tom's. I think where I have found qualitative work to be the most beneficial is if you are in a space that is either like there's minuscule amounts of data or it's just never been explored before, right? It helps identify the thing that has yet to be addressed. And the example I can give is my former doctoral student, Alyssa Mameni, who's out on faculty at New Mexico now. As part of her dissertation, she developed return to the classroom guidelines for college students. And at the time she started, I think there were like 4 papers in the literature that addressed this. It was nothing. So part of her dissertation was getting firsthand accounts from students, from instructors, and then from staff supporting the students on kind of their experience of getting back into the classroom, which then drove what was a second document in her work was an actual policy. Or suggested guidelines. And then I'll just brag a little bit on her that UHS adopted those guidelines last month campus-wide. So that was a really nice way for her to use kind of those stories to then inform kind of what this policy became, and then we got it implemented just a month ago.
Great, thank you. Yes, so please join us in thanking the panel. And Trish will now come up to introduce the next part of our forum.
So thanks again to our wonderful panel. That was fantastic to hear your experiences. And so now, building on the conversations that you all had at your tables before about your own ideas about innovation and impact, and then what you've heard up here, now what I'd like you to do is really take all of that and think about, given these definitions of innovation and impact, how do you think IHPI can best help to support you in your work in these realms? And so we're gonna, in the interest of time, we're gonna just briefly, again, brainstorm on your own, some ideas for how you think IHPI can help to support this work. And then I want the whole table to discuss them and kind of maybe narrow it down to your top 3 ideas that you think IHPI can potentially implement. And then we're going to share out from the table. So I'm going to give you 3 minutes to do a quick brainstorm on your own, and then we'll transition to the table discussion. Thanks. Okay, everybody, we're going to ask for some volunteers to share some of your ideas that were generated at the tables, and we will collect any written material that you're willing to give to us with your ideas. We would love to have it. But if there are any tables who would be willing to share, we've got Jeremy and Jessica have our mics. So just raise a hand if you have some things that we could be doing. Chad, okay.
Yeah, I was thinking about communications in a post-Twitter world, like, you know, as Twitter's on decline, and or ways that Kara Gavin could replace Elon Musk and take over Twitter and bring it back to a healthy, reasonable space instead of this cesspool it is. In? You're in. She said yes. She said yes.
Okay. Anyone else? Let's see.
So we were thinking about how there weren't any new ideas, but it really came down to remembering to use the services that IHPI has. And so in that interest, we thought of periodic reminders or showcasings of what we do offer, like the different groups, communication, data and methods hub. And then also in that interest, potentially instituting office hours. Sometimes it feels a little intrusive to reach out and ask for something, but if someone's built this protected time for that, it might help ease that.
Thank you. Okay. Other tables? Over here? Okay, great.
I have the mic. So our first idea is an incubator open mic from our table, because sometimes it's before you're writing the grant or the paper. It's like you want lots of feedback on your ideas. If there's a way we could get people from each of the IHPI teams, or, across disciplines, faculty, and, whether it's using a seminar or something like that, getting early feedback on half-baked or less than half-baked ideas was something we talked about. And then to build on this last comment, a roadmap for different stages of a research project when you could engage IHPI resources, particularly the human resources we've talked about today, but also doing so in a way that wouldn't overwhelm those resources, which is really a question for you, when to engage IHPI staff and programs.
Thank you. And we do have the career development roadmap that was developed by members of our early career faculty advisory council and our education and training group. But this sounds like something a little bit different, Raina. You're talking about within the life of a research project, sort of having, okay, thank you. Other two, yeah.
So Trish, I had two things. So there, I think that if I look at the origin of open, the two things that IHPI did were bringing the Medicaid director here. So when Chris Priest came, that was such a transformative time. And then thinking about the group of people that came together in Inglesby, getting a group of people together and just making people pitch an idea, no agenda, just what's your next big idea? What are you interested in? And we had breakfast. It was like Brahmaji and Justin Demick, Jen Walji, and then all of a sudden Walji's writing an R01. I mean, that kind of stuff really matters. I think it's hard to get people to show up without an agenda, but I think just pitching ideas from diverse faculty members can be ways that whole new initiatives can start.
Thank you. A couple more tables. Oh, here's one.
Hi, everyone. My name is Rachel Toko, and I'm Managing Director of the National Dementia Workforce Study. I'm in the Department of Psychiatry, and I have something to confess. I am a staff member, not a faculty member. And so our table was talking a lot about the different ways that staff can become involved with IHPI events. I think IHPI, the mission is to support the faculty body here at the university, and there are also many programs for the learners and the students. There are some ways that staff can participate in IHPI events, but I think we are an untapped resource for the faculty community. So when I think about what can IHPI do to help catalyze innovation, I think that connecting the staff who've built their careers in health services research and have a breadth and depth of expertise, I think connecting people like me, people like us, there's a professional community of us. And if we can find ways to directly connect with you, I think new ideas would pop, and new ideas for ways to do your research would pop. And I just, I think there's a gap. And so that's my suggestion. And I'm happy to directly connect with IHPI to further discuss these ideas. Thank you.
Thanks. Mark.
Hi, I'm Mark Bickett. At our table, we discussed kind of some themes that were similar to what Chad had mentioned. Coordinating policy activities or visits that could be external, meaning for individuals to coordinate visits themselves to the Capitol, whether it's the state or nation, right? That's pretty taxing. But if there was an organized way to kind of have a time of year where we go do that, that could make a lot of sense for our groups, or vice versa, have them come here, which may be a little easier. We also mentioned the idea of having workshops or convenings, maybe kind of like the brainstorming sessions that were mentioned earlier, but they could be fairly open or perhaps on emerging topics that we think are relevant. For example, after COVID, right, we had this big emphasis on the telehealth, and that emerged into the telehealth network. And the question is kind of what would be the logical step for 2024 or 2025 that's coming up? So we might not know those topics. That might be something helpful.
Thank you. Does one more table want to share? I saw lots of people writing down lots of good ideas. Oh, here we go. Okay.
There we go. We were talking about a program where researchers from different disciplines could be paired to discuss each other's projects and kind of provide consultation, and maybe even kind of decide from that point on how involved they'd like to be in each other's projects, because a lot of the times we might find that we're missing something, or there's a different way to think about this, and we're within our own department, so we're kind of just always doing the same things. So it'd be helpful to maybe be paired with someone from a different department or a different discipline, and any kind of different organization, really, so that we could really point out different ways of thinking about things.
Great, thank you. Well, thanks to everybody for your thoughts, your contributions. If there's any, please leave the big pads on the table. If there's any other scraps of paper that you'd be willing to leave, we do really take all of these ideas into consideration. So thank you so much. And now I'm gonna turn it over to John to introduce the last portion of our program.
So thanks for all those great discussions and sharing your thoughts from the tables. We now get to finish the member forum today on a high note. I want to welcome Professor Paula Lantz, a member of the IHPI leadership team and faculty lead for our policy engagement and external relations team, and professor at the Ford School of Public Policy, to present our Policy Impact Awards for 2024.
Hello, everyone. As the IHPI Policy Faculty Advisor this year, it is my pleasure to present the IHPI Policy Impact Awards for this year. Among an incredible set of nominees, I have to say, we are really pleased to be honoring 2 recipients this year. Since 2014, IHPI has recognized outstanding faculty members whose work has had a substantial impact on health policy or practice at the local, state, federal, even international levels. The annual award recognizes research that addresses pressing questions related to health, and also healthcare quality, safety, equity, and affordability. And this work has directly informed health policy and our clinical practice. Beyond publishing in academic journals, the recipients of this honor have actively engaged with policymakers or key policy stakeholders. So we'll start with Dr. Steve Broglio, who you just heard from a moment ago. It's really a privilege to announce Dr. Broglio as a Policy Impact Award recipient this year. He's professor and associate dean at the School of Kinesiology and director of the Concussion Center at the University of Michigan. He's an internationally renowned concussion researcher whose dedication and contributions have shaped the neuroscience landscape and influenced the lives of active individuals everywhere. He's being honored today for his commitment to mitigating the risk of and improving outcomes from concussion through his leadership at the local, state, national, and truly international levels. Dr. Broglio's efforts to translate his research have resulted in a standardized approach to concussion management, the development of both return to learn and return to play policies that are universally used by healthcare practitioners. And he's also contributed to the creation of training resources utilized by sport and healthcare leaders around the world. He has successfully disseminated his findings to thousands of people worldwide, literally. And his work has served to inform decisions made by state and local leaders, members of Congress, the Secretary of the Army, the NCAA, U.S. soccer, and U.S. cycling organizations to inform concussion management and assessment policies. In 2014 and in 2024, Dr. Broglio led the development of the National Athletic Trainers Association position statement on concussion management, and he contributed to the development of the International Concussion in Sport Group's consensus document in a number of years. Beginning next year in 2025, Dr. Broglio will serve as the president of the Concussion in Sport Group. So for your amazing work and efforts that have improved the health and safety of active individuals around the world, we look forward to more of your work in the years to come, and congratulations on receiving this award today. Oh, do you have any remarks?
I will now. I did prepare a couple things. So first of all, Paula, thank you for connecting with my mom for that introduction. That was amazing. In all seriousness, thank you to the IHPI for the award, but really this is not about the work that I've done. It's really about the work that the people around me have done. And I'm just the fortunate one that gets to stand up here today. I mentioned earlier about the Concussion Center. We're about 5 years old, so a little bit younger than IHPI, but we have about 150 members across the campus, and it's really their commitment to better understanding the injury, how to identify, manage, and then what are the long-term effects of the injury that has made us so successful. I do want to thank my mom, seriously, of course, because every thank you speech should include your mother. But I also want to thank the university for really giving us the resources, and then the exceptional people that are here at all units on campus. And we work with 35 different departments across campus, the work we do. IHPI has certainly been instrumental in the work that we do. So John for his leadership. Eileen, who I mentioned earlier, has really kind of held my hand along the way as I cried like a baby, resisting everything. And then I told Christina in the back I'd give her a shout out because she used to be in kinesiology, but then came up to IHPI a few years ago. But we continue to stay in touch, and she always gives me good guidance. The last two people I want to thank my partner, Heather Shea. She's a faculty member at that school 60 miles north of here, whose name shall not be named. And then, of course, most importantly, my daughter, Lily, who is 16 going on 35 and challenges me in the most amazing ways every day. And I don't mean that as a teenage daughter challenging her father, but as somebody who has a vocabulary that is so ginormous. Literally last week, I was like, that word you just used, I learned it a month ago, and she's 15. So I've had her write speeches for me. She's written scripts for some of the training modules that we've done in the center. For people that are worried about the future, we're in really good hands. So thank you very much. I really do appreciate it. Thanks.
Okay. And now I'm so pleased to present our second Policy Impact Award of the day, and that's going to Dr. Chad Ilamutil. He's an associate professor of urology in the School of Medicine, widely recognized leader in the rapidly evolving field of virtual care. And he's being honored today for his efforts to advance the understanding and implementation of telehealth across the state of Michigan and the nation through his research and proactive engagement with key policy decision makers. Dr. Ilamutil has translated his research and the resulting policy implications into policy briefs and reports, including on such topics as telehealth during the COVID-19 pandemic, the use of telehealth among Medicaid beneficiaries, and telehealth's impact on Michigan residents' access to health care. He regularly shares his impressive work with numerous policy stakeholders, including state and federal legislative offices, the Department of Health and Human Services, and also the Centers for Medicare and Medicaid Services. As a result of his expertise, he was invited in November of 2023 to testify before the U.S. Senate Committee on Finance, Subcommittee on Health, in a hearing related to establishing telehealth as a permanent healthcare option. His expert opinion was also sought by Senators Cardin and Daines to facilitate bipartisan understanding and support for permanent telehealth coverage. And he met with Representative Mike Thompson's office to inform the Connect for Health Act. Dr. Ilamutil has presented his research to the Medicare Payment Advisory Commission and the Assistant Secretary for Planning and Evaluation, among other key stakeholders. Here at the University of Michigan, he serves as the Medical Director of Telehealth, where he assisted in the development of Michigan Medicine's 5-year strategic plan for virtual care. He also established the Telehealth Research Incubator with the mission to catalyze and disseminate IHPI member research on the role of telehealth in improving healthcare access, enhancing patient experience, the trifecta, also reducing costs. Dr. Ilamutil demonstrates his commitment to working in the best interests of the public and patients through his tireless work to inform policy stakeholders on telehealth's ability to improve health and well-being. Please join me in congratulating him on a Policy Impact Award.
I also have some prepared remarks. Well, thank you so much for the award, and most importantly, thank you for everything that IHPI has done to even put me in a position where I could even be nominated and be able to accept an award like this. For my couple minutes of remarks, I'll talk about my own personal career journey and really the important role that IHPI has played in it. We were just during the last session kind of joking about like, what else can IHPI do? I was like, I don't know what else IHPI can do. They do so much. So I joined the faculty in 2016 after completing the IHPI master's program. And then, I'm a urologist. So back then I saw the value in doing video visits. I was doing video visits with patients that had kidney stones that were traveling 2 hours to come see me for a 15-minute appointment. And that just didn't make sense. There had to be a better way to deliver this type of healthcare. And so for me, this virtual care has always made a lot of sense clinically. And then as I'm looking into why we couldn't do it, it was policy barriers. And so that seemed like the perfect area to do policy research. And so I've always kind of felt like it was a great space for HSR. And I'm going to talk about kind of 3 big ways that IHPI really helped propel my career. But hearing all the IHPI staff here kind of go over everything that they've done, I realized that there's actually so many more ways that I won't even be able to talk about in 2 to 3 minutes. And part of it is it's just so natural how I've over since 2016, even earlier when I was a fellow here, just integrated into all the resources that they have here. So I would highly encourage you, especially if you're early in your career, to do the same thing too. Lauren was up here, and I remember Wendy and Lauren helping to write proposals that we submitted, Patrick and Catherine, who helped really establish the Medicare research lab that I have, Emma, who's done a ton of work with us in telehealth, Kara, who is just like my #1 contact for anything related to media, who used to text me about a journalist that has a question, and now those journalists just reach out to me directly. Eileen, can't speak enough about how much over the last 8 years, how importantly she kind of helped, just like Steve mentioned, just ushered my way through all these policy conversation. Megan and Christina for the work in communications. And so the list just goes on. And I know I've definitely missed people, but it's just been such a nice way that the work has been integrated into all the resources that IHPI has. But I will talk about 3 big things that I think that IHPI did for me. First was in 2018. So I felt like telehealth needed to be understood from a HSR lens. And in 2018, M.P.P with Eve and IHPI together had a research challenge, and that research challenge was some startup funding to start a new line of research. And what I was pitching was that we should start studying telehealth through the HSR lens. There's thousands of studies that have looked at telehealth from a clinical perspective, but people aren't talking about the impact on cost, access, and quality. And so that was the pitch, and they bought it. And ended up getting that research funding. But that was 2018. The volume of telehealth was so low. People were not talking about telehealth back then, but they believed in me and they believed in the idea. They understood the passion and they decided to invest in it. So I think that was really the beginning of this career that I've built. And then a few years later, this is still pre-COVID, they doubled down. And so with Trish and Emma, we created the strategic initiative for telehealth. And so the idea there is that let's find everyone here at IHPI that's doing telehealth research, and let's create this collective lens or collective voice. Let's start putting research out together. You're doing behavioral health. I don't do research in behavioral health, but your research can help inform conversations related to behavioral health. So let's get their research out there. So that was the strategic initiative that was created for telehealth, which has been very successful. And then the third thing was just really simple, was working with Eileen and Sarah to develop just the most basic thing ever, is just a listserv. And the listserv is just a list of people. Whenever you have a meeting with someone, we'll put them on the listserv. And we built this external listserv where we could disseminate information. And it sounds so simple, but it helps the external world know that you exist. And maybe they are not necessarily interested in that particular policy brief that you just sent out, but they know that you exist, you do this research, and a year later when the time comes, they may be calling you to do a congressional testimony or to sit on an Academy Health panel with the Congressional Budget Office and others, which I'll be doing in June. So one thing kind of led to another by just a really simple intervention. And then, there was the pandemic, which of course really kind of helped make, bring telehealth into the mainstream. But, with the pandemic, all of a sudden now that all these HSR questions are really important. They're really important to policymakers. And you think about how to pay for telehealth after the pandemic is over. And that just led to a lot more opportunities. But that opportunities were because of the groundwork that was set up by IHPI, since 2016. And so the theme of this whole meeting is innovation to impact. And I think that's extremely important, probably something that we need to revisit every year, because as society evolves, the way that we make an impact also evolves. So we're in a state of society where we have information overload, and there's so much information out there. So that JAMA paper that you worked on for a year and a half was on my Twitter feed for about 5 seconds, probably even less on X, so there's so much information. So how do you get your ideas, your research out in front of people, which is really the most important part. I think the idea, the manuscript is 10%, 90% is actually dissemination. So having IHPI experts to help you get that work out there, and I'll be completely honest with you, I don't think any of my work is groundbreaking. I didn't come up with a new molecule. I didn't do anything that's really groundbreaking, but it was just, I get information that's relevant, that policymakers are talking about in front of them in a way that they understand, and that's kind of been the sort of the motto and the way that I've had success with it. So I wholeheartedly thank IHPI for everything that they've done to help get my work to places where it makes an impact, and thank you for the award.
So that certainly wrapped up our afternoon together on a high note. Congratulations to Steve and Chad, and thank you to Paula and the policy engagement team for overseeing the nomination and selection process for this award. And it's always very gratifying to hear from our award winners every year about how their careers have developed and how they've translated their work here at the university into broader impact. So I want to, again, thank you for joining us. We actually have some time here in this room for another period. If you want to, our staff will be staying. I'll be sticking around. Any of you that are able to, we encourage you to stay and connect with colleagues, continue this networking opportunity. And on your way out the door, we want to encourage you to pick up our piece of swag that we'd like to share with you, the IHPI umbrella. We really see this as a way to keep you dry on your journey from innovation to impact. So pa-dum-bum on that note. Thanks again, and we look forward to seeing you not just a year from now, but throughout the year at various IHPI events. So thanks very much.